Bismillahirrahmanirrahim. Quote of the day: the best view comes after the hardest climb. Today, the topic of my presentation is one of non-communicable diseases, hypertension, under kind supervision of Professor Dr Saira Afzal. Learning outline of my presentation. Today we know about what is non-communicable diseases, hypertension, categories of hypertension, preventive strategies of hypertension treatment, recent updates, and at the end there is an MCQ session. At the end of this presentation, participants will be able to describe about hypertension, categories of hypertension, and recent updates. There are some key facts from WHO about the hypertension. Hypertension or elevated blood pressure is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. An estimated 1.28 billion adults aged 30 to 79 years worldwide have hypertension, most living in the low and middle income countries. As estimated, 46% of adults with hypertension are unaware that they have the condition, and less than half of adults, almost 42%, with hypertension are diagnosed and treated. And approximately 1 in 6 adults, almost 21%, with hypertension have it under control. Hypertension is a major cause of premature death worldwide. One of the global targets for non-communicable disease is to reduce the prevalence of hypertension by 33% between 2010 and 2030. Now, what are the risk factors for hypertension? An aspect of personal behavior or lifestyle, and environmental exposure, or a hereditary characteristic that is associated with an increase in the occurrence of a particular disease, injury, or other health condition. There are two types of risk factor for hypertensive disease: modifiable risk factor, a risk factor that can be reduced or controlled by intervention; physical inactivity, tobacco use, alcohol use, or unhealthy diet. And some are non-modifiable risk factors which cannot be reduced or controlled by intervention, and that must be age, gender, race, and ethnicity. Hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure in the arteries is elevated. High blood pressure usually do not cause any symptom, but long-term high blood pressure is a major risk factor for certain diseases like stroke, coronary artery disease, heart failure, atrial fibrillation, peripheral artery disease, vision loss, CKD, and dementia. This is the new guidelines from American Heart Association or American College of Cardiology. According to the blood pressure, the normal classification of blood pressure is 90 to 119 is systolic and 60 to 79 is diastolic. And pre-hypertension stage nowadays is considered 120 to 139 and 80 to 89 diastolic. And stage 1 hypertension is labeled when a person suffering from 140 to 159, and diastolic is between 90 to 99. And stage 2 hypertension is labeled when there is more than 160 blood pressure systolic and more than 100 diastolic. And this is known as isolated systolic hypertension when the elevated blood pressure is more than 140 and less than 90. This is the sign and symptom of high blood pressure: dizziness, blurred vision, rapid heart rate, lack of concentration, and fatigue. There are many methods to measure the blood pressure, and one of the method which is used is we use an instrument which is called sphygmomanometer, and there are many type of error in this measurement occur when we measure the blood pressure, like observer error, instrumental error, and subject error. Categories of hypertension. There are two categories of hypertension: primary hypertension and secondary hypertension. Essential hypertension or elevated BP without any identified cause, and secondary hypertension, elevated BP with a specific cause. causes renal disorder, drug-induced endocrinal disorder, and coarctation of aorta. Hypertension is an iceberg of disease, and a rule of half is followed in the case of hypertension. For example, in a community, if we found in the community there are 50% of people are normotensive and 50% are hypertensive. And the people who are hypertensive, 50% are undiagnosed and 50% are diagnosed. And the diagnosed cases of hypertension, in which 50% are untreated and 50% are treated. And from treated patient of hypertension, the 50% are inadequately treated and 50% are adequately treated. So this is called the rule of half in case of hypertension. Tracking blood pressure. The phenomena of persistence of rank order of a blood pressure on follow-up over a period of years from early childhood to adulthood helps in identifying children and adolescents at risk of developing hypertension at a future date. There are certain risk factors for hypertension. Non-modifiable and modifiable increase with age, sex. Male are more prone to female. More risk in menopausal female, genetic factor more than 45% higher risk in children with two hypertensive parents, ethnicity higher in Black communities, and modifiable risk factor, obesity, salt intake, saturated fat, dietary fiber, alcohol, stress, physical activity, and socioeconomic status. Now come towards the preventive strategies of hypertension. There are primary prevention, secondary, tertiary prevention. And in the primary prevention, all measure to reduce the incidence of hypertension in a population by reducing the risk of onset with the help of population strategy or a high-risk strategy. What can we do in the population strategy? Directed at whole of population, irrespective of individual risk level, goal to shift the community distribution of BP towards lower level or biological normality. Involve multifactorial approach like with the help of change in the nutritional activity, weight reduction of the community, exercise promotion, behavioral changes towards their eating style, and health education. What can we do in the nutrition? We reduce the salt intake. Less than 2.4 grams sodium or 6 gram NaCl is recommended for a diagnosed hypertensive patient. Moderate fat intake and avoid alcohol intake. Dietary approach to stop hypertension. This is one of the diet which is also known as DASH diet, which is used for the lifestyle modification in the hypertension, developed by the National Heart, Lung and Blood Institute. Eating diet plan which is low in saturated fat, low in cholesterol and low in total fat, and the more emphasis on fruits, vegetables, low fat and fat free milk, potassium, calcium and magnesium diet. This is the DASH diet, in which the food groups you can take is grains, 7 to 8 servings per day, vegetables 4 to 5 servings, and fruit 4 to 5 serving, low fat dairy foods 2 to 3 in number, meat, fish and poultry 2 or less in number, and nuts, seeds and dry beans 4 to 5 in weekly. And in the population strategy, we can reduce weight, almost the BMI less than 25 kg, and exercise promotion more than 150 minutes a week of moderate physical activity, 30 minutes per day for at least 5 days in a week. And in the behavior changes, stress reduction techniques, there are many different techniques which are used for the stress reduction and stop smoking, health education and self-care. High-risk strategy. In high-risk strategy, directed towards the people who are having a greater risk of hypertension, aim to prevent attainments of level of blood pressure at which institution of treatment would be considered, This approach is appropriate if risk factor occur with very low prevalence in community, since clustering of hypertension occurs in a family. Individual at risk can be identified with family history of hypertension or tracking of blood pressure from childhood. Now comes the secondary prevention. Goals to detect and control high BP in an affected individual. Early case detection by screening. Because hypertension is a silent disease and a treatment, only control is possible to prevent complication, and other risk factors like smoking, high cholesterol level are also addressed and ensured through education directed to patient families and the community. There are multiple antihypertensive drugs which are used to control the blood pressure, like diuretics, central-acting agent, methyl-dopa, beta-adrenoreceptor, alpha-adrenoreceptor blocker, combined alpha and beta blocker, ACE inhibitors, angiotensin receptor blocker, calcium channel blocker, and a vasodilator. These are the complications of hypertension which can be avoided through proper preventive techniques like stroke, retinopathy, peripheral vascular disease, renal failure, left ventricular heart failure, chronic heart disease, or heart failure. Drugs to be avoided for treatment of hypertension when the person is also suffering from another disease, like in pregnancy, angiotensin converting blockers, angiotensin receptor blocker, beta blocker, and diuretics are avoided. And in the diabetes, diuretics and beta blocker must be avoided. And in angina pectoris, vasodilator cannot give to the patient. And in the bronchial asthma, beta blockers cannot be used. And also in peripheral vascular disease, beta blocker cannot be used. And for patient of chronic heart failure, we cannot we can use calcium channel cannot use calcium channel blocker. We can use calcium channel blocker except amlodipine, alpha and beta blocker. In the lifestyle modification, lifestyle first coined by Austrian physiologist Alfred Elder in 1929, which means the way a person lives. It is essential for both primary and secondary prevention. Reduce blood pressure, prevent or delay the incidence of hypertension, enhance antihypertensive drug efficacy, and decrease cardiovascular risk. There are different categories of hypertension, like pregnancy-induced hypertension. Gestational hypertension or pregnancy-induced hypertension is the development of new hypertension in a pregnant woman after 20 weeks of gestation without the presence of protein in the urine or other sign of preeclampsia. Gestational hypertension is defined as having a blood pressure greater than 140 to 90 on 2 occasions at least 6 hours apart. Risk factor for the pregnancy-induced hypertension. Obesity, mothers under 20 or over 40 years of age, past history of diabetes mellitus, hypertension, and renal disease, pre-existing hypertension, thrombophilia, like antiphospholipid syndrome, protein CS deficiency, or factor V Leiden deficiency, having a donated kidney. These are the risk factors for pregnancy-induced hypertension. And the other causes is pregnancy, multiple gestation, twins or triplet, placental abnormalities like hyperplacentosis, excessive exposure to chorionic villi, placental ischemia, or a strong family history. There is no specific treatment of pregnancy-induced hypertension, but is monitored closely to rapidly identify preeclampsia and its life-threatening complications like HELLP syndrome and eclampsia. Drug treatment options are limited as many antihypertensive may negatively affect the fetus. The drugs which are used to treat the pregnancy-induced hypertension is methyl-dopa, hydralazine, labetalol are most commonly used drugs for pregnancy-induced hypertension. There are some other categories of hypertension, white coat hypertension and a masked hypertension. When the blood pressure reading at your doctor office are higher than in the other setting, such as your home, it is called white coat hypertension. And masked hypertension is defined as when blood pressure in the clinic or office is more than 140 to 90, but an elevated BP out of the clinic. This is called masked hypertension. Now it's time for the recent update. This is one of the article in which is about prognosis of white coat and masked hypertension. Home blood pressure monitoring is useful in detecting white coat and masked hypertension and is recommended for the patient with suspected or treated hypertension. Cardiovascular risk was higher in those with white coat hypertension and in masked hypertension and a sustained hypertension compared with a normotensive patient. White coat hypertension assessed by home measurement is a cardiovascular risk factor in untreated but not in treated subject, probably because the later receive effective treatment on the basis of their elevated office blood pressure. In contrast, masked uncontrolled hypertension is associated with increased cardiovascular risk in both untreated and treated patients who are probably untreated because of their low office blood pressure. These are the new American Heart Association high blood pressure guidelines. The normal blood pressure is less than 120 to 80 and the elevated is between 120 to 129 and diastolic less than 80 and stage 1 is 130 to 139 and diastolic 80 to 89 and stage 2 systolic more than 140 and diastolic at least 90. The guidelines eliminate the category of pre-hypertension, categorize patient as having either elevated because in addition, the guidelines stress the importance of using proper technique to measure blood pressure and recommended use of home blood pressure monitoring using validated device and highlight the value of appropriate training of healthcare providers to reveal white coat hypertension. Only prescribing medication for stage 1 if a patient has already had a cardiovascular event such as heart attack or a stroke or is at a high risk of heart attack or a stroke. The presence of diabetes or CKD. Recognize that many people will need 2 or more than 2 type of medication to control their blood pressure and that people may take their pills more consistently if multiple medication are combined into a single pill. Identifying socioeconomic status and psychosocial stress as a risk factor for high blood pressure that should be considered in a patient plan of care. These are the recommendations for measuring the exact BP. There are no conversation, empty bladder, use correct cuff size, place BP cuff on a bare arm, support arm at heart level, keep leg uncrossed and support back and feet. Now it's time for the MCQs. 45-year-old male comes to you for routine checkup. He has a family history of heart disease. The single most intervention to identify his risk factor for heart disease is serum protein, blood sugar level, hypertension, serum creatinine, or a serum cholesterol. C, hypertension. According to a multiple population-based studies in a community, 50% population is hypertensive, 50% is normotensive, and if hypertension, then 50% diagnosed and 50% non-diagnosed. Which type of rule explained in this statement? Rule of half, rule of 50s, rule of half century, rule of alpha is the right answer. Rule of halves. Alpha is the right answer. A 30-year-old male with history of high-risk cholesterol and positive family history of hypertension come to you for routine checkup. He is also a smoker for the past 5 years. Which intervention will have the most impact in the prevention of hypertension. Increase fiber diet, increase vitamin intake, stop smoking, screening the family history, and reduce cholesterol.
Alpha.
Charlie.
Alpha is the right answer. You are seeing 60-year-old man for the first time. He has untreated hypertension, 160 or 106 mm. Blood pressure has elevated on at least 3 occasions. There is currently no evidence of target organ dysfunction. From a therapeutic perspective, what is the best initial approach? Initiate treatment with 25 mg of hydrochlorothiazide. Consider initiating treatment with a 2-agent combination pill. Delay pharmacological intervention and treat with salt reduction. Increase fiber diet or routine exercise. Increase multivitamins.
Beta.
Beta is the right answer. Consider initiating treatment with a 2-agent combination pill. Hypertension is the leading cause of coronary heart disease and a stroke. There are many preventive strategies for controlling hypertension. Regarding nutritional perspective, which type of
Alpha.
plan is advised? Dash diet. Alpha. 40-year male is diagnosed with high blood pressure. Salt restriction is advised by healthcare professional. Amount of salt intake given to a hypertensive patient is less than 2.4 gram. Yes, alpha is the right answer, less than 2.4 gram of sodium. 45-year-old female having reading of a high blood pressure in doctor's office rather than in any setting like home. Which type of hypertension is this? White coat, masked, sustained hypertension, pregnancy-induced hypertension, stage
Alpha.
1 hypertension. 7 alpha is the right answer. According to a new guideline of American College of Cardiology, which stage of hypertension is eliminated? Pre-hypertension, stage 1, stage 2, stage 3, isolated elevated hypertension.
D.
D, stage 3 is eliminated. 40-year female having high blood pressure reading at home, but during the visit of a doctor's clinic, the reading is normal. Which type of hypertension is this? White coat hypertension, masked, sustained hypertension, pregnancy-induced hypertension, stage 2 hypertension.
B.
Beta.
Beta is the right answer, masked hypertension. ABC female, 60-year-old female, 5.4 inches height and 110 weight, who is diagnosed with stage 1 hypertension. Her BP average 135/85. She has no other comorbid condition and is otherwise in excellent health. Which initial therapy would the most appropriate for this female patient? Clonidine, diltiazem, furosemide, hydrochlorothiazide, or a lifestyle modification?
E.
E.
E is the right answer, lifestyle modification. This is the key of my MCQs, and thank you.
Thank you, Dr. Naila. If anybody has any questions, you can ask.
Thank you so much, ma'am.
Okay, thank you, Dr. Naila. Allah
Khuda
Hafiz.
Hafiz.